What is liquid biopsy for bladder health? Imagine a simple blood test or urine sample that can tell your doctor about bladder health without needing invasive procedures. That's what liquid biopsy for bladder health is all about. It's a cutting-edge, minimally invasive way to detect and monitor bladder conditions, especially bladder cancer, by analyzing fluids like urine and blood. Unlike traditional tissue biopsies that requiring surgery or needle insertion to get a tumor sample, liquid biopsies look for tiny pieces of tumor material that are shed into bodily fluids. This makes the process much easier and less uncomfortable for patients. In bladder health, urine is the most common sample used because it is in direct contact with the bladder lining. Tumors in the bladder often releases genetic material or cells into the urine, making it a rich source for testing. Blood samples can also be used to find circulating tumor DNA or circulating tumor cells, but urine tends to be more sensitive for bladder cancer detection because of its proximity to the tumor site. The main molecular markers detected through liquid biopsy include circulating tumor cells, which are cancer cells that have entered the bloodstream or urine, and circulating tumor DNA, which are small fragments of genetic material shed by cancer cells. These markers can carry genetic mutations associated with bladder cancer, such as changes in genes like FGFR3, PIK3CA, ERB2, and TP53. Detecting these alterations helps identify the presence of cancer, assess how advanced it might be, and monitor how well treatments are working. Clinically, liquid biopsy is used for several purposes. It can help in early diagnosis by spotting tumor markers before symptoms appear, potentially reducing the need for invasive cystoscopy. After treatment, it can check if any cancer cells remains, guiding decisions about further therapy or surgery. During follow-up, regular liquid biopsies can detect recurrence early, sometimes even before symptoms show up. Additionally, analyzing the molecular profile of the tumor helps doctors choose targeted therapies that are most likely to work, making treatment more personalized. One of the biggest advantages of liquid biopsy is that it is less invasive than traditional methods. It causes less discomfort and risk, and because it is quick and easy to perform, it allows for more frequent testing. This means doctors can keep a close on the disease and adjust treatments promptly. It also has the potential to detect cancer earlier, which can improve outcomes. However, liquid biopsy is still a developing field. While it shows great promise, it is not yet a complete replacement for tissue biopsies or cystoscopy in diagnosing and managing bladder cancer. The accuracy of the tests depends on the specific markers used and the stage of the disease. Ongoing research is working to improve the sensitivity and specificity of these tests, with some commercial options now available that use urine samples to detect bladder cancer more reliably. In summary, liquid biopsy for bladder health is a promising tool that uses urine or blood to find molecular signs of bladder cancer. It offers a less invasive way to detect, monitor, and personalize treatment for bladder conditions. As research advances, it could become an essential part of bladder health care, helping patients receive earlier diagnosis and more tailored therapies. Always remember to consult healthcare professionals for personalized advice and testing options suited to your specific health needs.